For almost 20 years, the Movember, the leading global men's charity, has been changing the face of men's health. Joining us is the U.S. Executive Director Mark Hedstrom to discuss the Movember movement and what you need to know about men's health to save more lives. Mark, thanks so much for joining us.
Oh, thank you for having me on.
Mark, let's start with, for people who may not be familiar, what is Movember?
Sure. So Movember is the global men's health charity focused on changing the face of men's health, and we've been doing this for 19 years. We started in Melbourne, Australia in 2003 and operate in 20 countries around the globe, and we focus on three cause areas that affect men's health. The first being mental health and suicide prevention amongst men and boys, the second being prostate cancer, and then the third being testicular cancer. And there are many diseases that men struggle with and face, and our focus is really raising awareness around those three particular areas and engaging men in a conversation and encouraging them to take action for their own health.
Yeah, absolutely. Let's talk about how important it is that men start having these conversations about health issues.
Well, I think it starts with really raising that awareness. So as I mentioned, when we focus on our cause areas, if you look at prostate cancer as an example, 1 in 8 men in the U.S. will be diagnosed with prostate cancer in their lifetime. And if you're a black man in America, you're twice as likely to die from that disease. So just engaging in some of the health risks that men have with respect to prostate cancer, and just as a reference, that's a similar type of incident rate that you see in breast cancer amongst women. So engaging in raising that awareness is the first step, and that's what the mustache does, and that's what Movember focuses on. But it's also moving to destigmatizing and encouraging the conversation amongst men. I think often what we found, whether it's prostate cancer or mental health, is that men struggle with talking about what might be going on with them, whether it's a physical or mental health issue. So how do we encourage them to have that conversation and then encourage them to take action when they have a health issue?
Sure. Wondering if you can share maybe some ways to engage a friend or family member that may be struggling with what you said, talking about, if it's a treatment from cancer or even those mental health issues.
Sure. We deploy a model here in the States as well as globally around ALEC, and it's a very simple acronym. It's ALEC, and the A stands for ask. So ask a man how he's doing. I think often what you find is that they struggle to explain what's going on with them, so give them the opportunity to explain it a little bit more. So ask them, and I think when they're responding, listen, and I often say listen without judgment, right? Listen to what the man is saying and how he's trying to articulate what might be challenging him. And then I think most importantly, we often find that men want to take action, right? And I think that's no different for their own health. So how do we encourage men to take action for their own health? How do we help them seek behavior or guide them to the places that they can actually have someone help them with that particular challenge they might have been dealing with? And then finally, checking back in. I think that's probably as important as anything else, is making sure you come back to that conversation and see how that man is doing. Is he taking action? Is he feeling better with that particular issue he might be dealing with in his life?
Yeah, certainly, and that's a great kind of call to action. What would you say are maybe 5 things, I'll throw out the number 5 things to know about men's health that can help save more men's lives?
Sure. I think the first is spend time with people that make you happy and make you feel good. I think we all want that. I think the next is talk more. So back to that conversation. Find those opportunities to listen or to talk about what might be going on in your own life, and find that person that's there for you. I think the next would be knowing thy numbers. So understanding the risks you might face. So if you have a history of prostate cancer in your family, understanding what that means for you and talking to your clinical team or your clinician about that issue. Know thy nuts. For young men, testicular cancer is the second leading cause of cancer amongst men between 15 and 35. How do you do a self-exam? And then finally, just engage more and actually move more physically in your life, because that's going to have both a mental and physical health benefit.
Yeah, I love that. And maybe one question that our viewers might have is, can men and women get involved in Movember?
Absolutely can. We can't have a conversation about men's health without the women in our lives. So both men and women can participate in Movember. They can understand what we're talking about in terms of engaging men in our lives. But if you go to Movember.com, you can grow a mustache. You can move for the 30 days, and that's both for men and women to engage each other in a physical activity or physical challenge for those 30 days. Or you can host an event. And then finally, you can mow your own way. So we're not prescriptive about how you engage in the conversation or participate in Movember or raise funds for men's health. But you can do your own thing within Movember on Mow Your Own Way and decide how that and what that looks like for you and make it your own.
I love that, Mow Your Own Way. Obviously, you got a mustache there, Mark. Is that something you keep all year long, or is it just for this season?
It's for the season. My partner's, she lets me get away with one in October and then obviously one for Movember.
Yeah, I got it. Well, thank you so much,
Thanks so much, Mark,
for joining us. We appreciate you.
Great. Thank you for having me.
Yeah. It's always good to have those conversations.
Very good.
Yeah, yeah.